Have you ever stopped for a moment and asked yourself a simple but powerful question? If you've been taking a blood pressure pill every morning for months, or even years, do you truly understand what it's doing inside your body? Not just the brief explanation on the prescription label or the few words you heard during a rushed doctor's visit, but what it actually does once you swallow it. More importantly, would you recognize the warning signs if your body started telling you something wasn't right? Millions of people take medications like Amlodipine, Losartan, or Lisinopril every single day without realizing these medicines affect far more than just the numbers on a blood pressure monitor. They influence your heart, your blood vessels, your kidneys, and even how your body reacts during illness. Understanding them isn't just helpful. It can protect your health and possibly prevent a medical emergency. I'm Dr. William, and my goal today is to give you the kind of clear, practical information that often gets left out of a short medical appointment. By the end of this video, you'll know how these 3 common medications work, why they are not interchangeable, and which warning signs should never be ignored. More importantly, you'll feel confident instead of confused whenever you take your daily medicine. To explain why this knowledge matters, let me tell you about Walter, a 74-year-old retired engineer who was known for being organized and disciplined. Walter never missed a dose of his medication. His daughter even arranged his pills in a weekly organizer, and he followed that schedule with the same precision he once used in his engineering career. When his doctor prescribed Amlodipine, Walter assumed it was simply another blood pressure medicine. As far as he was concerned, one pill was just like another. Unfortunately, that misunderstanding nearly cost him an entire year of enjoying the active life he loved. Only 3 months after starting the medication, Walter noticed something strange. His feet gradually became so swollen that his favorite shoes no longer fit. Every afternoon, his legs felt unusually heavy, making even short walks uncomfortable. The more he moved, the worse the discomfort became. Fear quickly took over. He convinced himself that his circulation was failing and even began searching online for information about heart failure. Naturally, the results only increased his anxiety. The surprising truth was much less frightening. Walter wasn't experiencing heart failure at all. His symptoms were actually a well-known side effect of Amlodipine. The real problem wasn't the medication itself. It was that no one had ever explained how it worked or what changes it could cause inside the body. This is where many people become confused. Although Amlodipine, Losartan, and Lisinopril are all prescribed to lower blood pressure, they work in completely different ways. Amlodipine belongs to a group called calcium channel blockers. Its job is to relax the muscles in the walls of your arteries, allowing blood to move more easily and reducing pressure inside the blood vessels. Lisinopril works differently. It belongs to the ACE inhibitor family, which blocks an enzyme responsible for tightening blood vessels. By preventing that process, the blood vessels stay more relaxed, making it easier for the heart to pump blood throughout the body. Losartan belongs to another group known as angiotensin receptor blockers, or ARBs. It targets the same blood pressure system as lisinopril, but works through a different pathway. While the end result is similar, the side effects and precautions can be very different. Understanding these differences changes everything. Instead of assuming every blood pressure medicine behaves the same way, you begin recognizing that each medication has its own benefits, risks, and warning signs. That knowledge helps you respond wisely instead of reacting with fear. Walter's swollen legs weren't a sign that his heart was failing. They were simply his body's response to how Amlodipine relaxes certain blood vessels. Once his doctor recognized the cause and adjusted his treatment plan, the swelling gradually improved, and within a few weeks, Walter was comfortably walking again in his favorite shoes. What happened to Walter is incredibly common, but it's only the beginning. One of the most misunderstood side effects of Amlodipine affects far more people than most realize, and understanding why it happens could save you months of unnecessary worry. In the next part, we'll uncover exactly why this swelling develops, why many people make dangerous mistakes after noticing it, and what you should do instead. Imagine looking down at your feet one evening and noticing your socks have left deep marks around your ankles. Your shoes suddenly feel tighter than they did that morning, and your legs seem unusually heavy after only a short walk. Most people immediately blame salt, poor circulation, aging, or even heart disease. Some become frightened enough to stop taking their medication without ever speaking to their doctor. Others try drinking less water because they believe they're retaining too much fluid. Unfortunately, both reactions can create even bigger problems. The truth is that if you're taking Amlodipine, Swollen ankles are often caused by the way the medication works, not because your body is failing. Here's what is actually happening inside your body. Amlodipine relaxes the small arteries, allowing blood to flow into your legs much more easily. However, the veins that carry blood back toward your heart don't relax to the same extent. This creates a small imbalance. Blood enters the tiny blood vessels more easily than it leaves them, increasing pressure in the smallest capillaries around your ankles and feet. As that pressure builds, some of the fluid naturally leaks into the surrounding tissues. That's why your ankles become puffy, your shoes feel tight, and your legs may seem heavier as the day goes on. This type of swelling is very different from the swelling caused by heart failure or kidney disease. In many cases, it isn't caused by eating too much salt either. Instead, it's a predictable effect of how amlodipine changes blood flow. Understanding this difference is incredibly important because it keeps people from making decisions that could actually harm their health. Unfortunately, many patients panic when they notice swelling. Some immediately stop taking their medication without medical advice. Their blood pressure quietly rises again while they believe they've solved the problem. Others become afraid to drink enough water because they think less fluid means less swelling. In reality, dehydration can create additional complications, especially while taking blood pressure medication. Then there are people like Walter, who simply accept the discomfort, reduce their daily activities, and spend months worrying about diseases they don't actually have. The better approach is much simpler. If you notice swelling while taking amlodipine, don't ignore it and don't try to solve it by yourself. Instead, tell your doctor exactly what you've noticed. Sometimes adjusting the dose makes a difference. In other situations, changing the timing of your medication, elevating your legs during the day, wearing appropriate compression stockings when recommended, or switching to another medication may greatly reduce the problem. Every person's body responds differently, and your treatment should be tailored to your individual needs. Now let's move to another medication that causes confusion for thousands of people every year: Lisinopril. Unlike amlodipine, its most well-known side effect isn't swollen ankles. It's a cough, but not the kind of cough most people expect. This cough is usually dry, irritating, and persistent. It feels like there's a constant tickle at the back of your throat that refuses to disappear. Cough drops don't help. Allergy medicine rarely makes a difference. It often becomes worse at night, interrupting sleep and leaving people exhausted the following day. What makes this side effect especially confusing is that it doesn't always appear immediately after starting the medication. Some people notice it within days, while others develop it several months later. By then, almost nobody suspects their blood pressure medicine. Instead, they blame allergies, dust, dry air, acid reflux, or the lingering effects of a cold. That's exactly what happened to Evelyn, a 71-year-old woman who loved spending time in her garden. Her cough began during spring when pollen filled the air, so she naturally assumed seasonal allergies were responsible. She bought antihistamines, installed an air purifier, and even underwent medical testing. Her chest x-ray showed nothing abnormal, yet the cough refused to disappear. Month after month, it disrupted her sleep and slowly affected her quality of life. Everything changed during one simple conversation. When she reviewed the timeline of her medications, she realized she had started taking lisinopril months before the cough appeared. The connection had never crossed her mind. After discussing the situation with her healthcare provider, she was switched to Losartan, a medication that controls blood pressure through a similar system but rarely causes this particular side effect. Within only 2 weeks, the cough that had troubled her for almost a year completely disappeared. However, there's another symptom linked to lisinopril that is far more serious than a dry cough. It's uncommon, but every person taking this medication should recognize it immediately because acting quickly can make all the difference. In the next part, we'll discuss that medical emergency, explore why Losartan requires special attention to potassium levels, and reveal several everyday products that many people unknowingly combine with these medications, putting themselves at unnecessary risk. A dry cough can certainly become frustrating, but there is another reaction to lisinopril that belongs in a completely different category. It isn't simply uncomfortable. It can become life-threatening if it's ignored. Although this complication is uncommon, every person taking an ACE inhibitor needs to recognize it immediately because waiting even a short time can be dangerous. If you ever notice sudden swelling of your lips, tongue, face, or throat while taking lisinopril, especially if swallowing becomes difficult or your breathing starts to feel restricted, don't wait to see if it improves on its own. Don't assume it's an allergic reaction that will disappear after taking an over-the-counter antihistamine. And don't decide to call your doctor's office the following morning. This condition, called angioedema, is a true medical emergency because the swelling can progress quickly and block your airway before you realize how serious the situation has become. Fortunately, it's rare, but knowing the difference between a harmless dry cough and dangerous throat swelling could save a life. Now let's shift our attention to Losartan. Many people think it's simply another blood pressure pill, but it comes with its own important precautions that often go unnoticed. Losartan works by affecting the renin-angiotensin system, one of the body's key mechanisms for controlling blood pressure. While this makes it highly effective, it also influences the balance of potassium in your bloodstream. For most patients, potassium levels remain perfectly safe as long as they receive routine monitoring. Problems usually begin when certain everyday habits unknowingly increase potassium even further. This is where many well-intentioned people accidentally create unnecessary risks. Think about how often you've heard advice to reduce sodium intake. It's excellent advice for many people with high blood pressure. As a result, countless shoppers choose salt substitutes instead of regular table salt because the packaging proudly advertises them as a healthier option. What many don't realize is that these products often replace sodium with potassium chloride. That small change can become important if you're taking Losartan or Lisinopril. Imagine someone who has faithfully switched to a potassium-based salt substitute, sprinkles it generously on every meal, drinks electrolyte beverages after exercising, and occasionally uses nutritional shakes that also contain significant amounts of potassium. Individually, none of these choices seem dangerous. Together, however, they may gradually push potassium levels higher than intended. High potassium doesn't always produce dramatic warning signs. In fact, that's what makes it so deceptive. Some people simply feel more tired than usual. Others develop unusual muscle weakness, leg cramps, tingling sensations in their hands or feet, or notice their heartbeat feels irregular or fluttering. Occasionally, there are almost no symptoms until potassium reaches a level that begins interfering with the heart's electrical system. This doesn't mean you should fear potassium-rich foods or immediately remove healthy fruits and vegetables from your diet. Foods containing potassium remain valuable parts of a balanced eating plan for many individuals. The real message is awareness. Your doctor needs to know about supplements, electrolyte powders, meal replacement drinks, sports recovery beverages, and salt substitutes, because these products can quietly contribute more potassium than most people realize. Another situation deserves just as much attention because it catches countless patients completely by surprise. It has nothing to do with taking the wrong medication or forgetting a dose. Instead, it happens during ordinary illnesses that almost everyone experiences sooner or later. Picture yourself dealing with a stomach virus. You've spent the day vomiting or having diarrhea. Maybe you haven't been able to keep food down, or perhaps you've lost your appetite completely. It could even be a week of extreme summer heat when you've been sweating heavily without drinking enough fluids. During times like these, your body's internal balance changes dramatically. When dehydration develops, medications like Losartan and Lisinopril may behave very differently than they do under normal conditions. The exact same dose that works perfectly when you're healthy can suddenly lower your blood pressure too much. Your kidneys, already stressed because they're receiving less fluid, become more vulnerable. Dizziness, weakness, lightheadedness, or even sudden kidney injury may develop much faster than most people expect. The medication hasn't suddenly become unsafe. Instead, your body's environment has changed, and the medicine is now working under completely different circumstances. That's why experienced physicians often emphasize the importance of having a sick day plan. Before illness ever happens, you should already know what to do if you become dehydrated, can't eat, or can't keep fluids down. Should you temporarily hold your medication? Should you continue taking it? When should you contact your healthcare provider? These questions are far easier to answer before you're sick than during an emergency. But dehydration isn't the only hidden danger that catches people off guard. There is another incredibly common mistake involving everyday pain relievers that many people never think to mention to their doctor. In the next part, we'll uncover how common over-the-counter medications can quietly increase the risk of kidney damage when combined with blood pressure medicine. And we'll discuss one symptom that many older adults dismiss as harmless, even though it can lead to life-changing injuries. Now imagine this situation. Your arthritis suddenly flares up. Your knees ache every time you stand, your back feels stiff, and even walking across the room becomes uncomfortable. Like millions of people, you stop by the pharmacy and buy a bottle of ibuprofen or naproxen. After all, they're sold over the counter, so they must be harmless, right? That's exactly where many people unknowingly put themselves at risk. If you're taking lisinopril or losartan, and especially if you're also prescribed a diuretic, a medication that helps remove excess fluid, adding anti-inflammatory pain relievers can place significant stress on your kidneys. Doctors sometimes refer to this combination as the triple whammy because each medication affects kidney blood flow in a different way. Alone, each drug may be completely appropriate. But together, particularly if you're even slightly dehydrated, they can reduce blood flow to the kidneys enough to increase the risk of acute kidney injury. The reason this happens so often is simple. Most people don't think of over-the-counter medications as real medications. They're available without a prescription, so they seem separate from the medicines prescribed by their doctor. But your kidneys don't care where a drug came from. They only respond to the chemicals entering your bloodstream. If you regularly rely on ibuprofen, naproxen, or similar anti-inflammatory medicines for arthritis, joint pain, or chronic back discomfort while taking blood pressure medication, don't simply assume everything is safe. Bring the subject up with your healthcare provider. In many cases, there are safer alternatives. Acetaminophen may be appropriate for certain types of pain. Topical creams and gels can sometimes provide relief without exposing the kidneys to the same risks. Physical therapy, stretching programs, weight management, or other treatments may also reduce pain while protecting your overall health. The important message is that you have options, and you don't have to make these decisions alone. Now let's talk about another symptom that countless older adults brush aside every single day: dizziness. Perhaps you've experienced it yourself. You stand up from your favorite chair, and for just a few seconds, the room seems to tilt. Maybe you grab the armrest or steady yourself against the wall before everything returns to normal. Most people shrug it off, thinking, "I stood up too quickly." Then they continue with their day as though nothing happened. But for someone taking blood pressure medication, those few seconds deserve attention. As we age, balance naturally becomes less reliable. Muscles react more slowly, bones become more fragile, and recovery after an injury takes much longer than it once did. A brief spell of lightheadedness that lasts only a few seconds can be enough to cause a fall. And a fall can change a person's life in an instant. Hip fractures, broken wrists, head injuries, and spinal fractures often begin with nothing more dramatic than standing up too quickly after sitting for a while. For many older adults, recovering from these injuries can take months. Some never regain the same level of independence they enjoyed before the accident. Why does this happen? Ironically, it's often because your medication is working exactly as intended. Blood pressure medicines lower pressure inside your arteries. When you suddenly move from sitting or lying down to standing, gravity immediately pulls blood toward your legs. Normally, your heart and blood vessels adjust almost instantly to maintain steady blood flow to your brain. But while taking blood pressure medication, that adjustment may take a few extra seconds. During that brief delay, blood flow to the brain decreases slightly, producing dizziness or lightheadedness. Fortunately, preventing this is often straightforward. Before getting out of bed, sit on the edge for a moment. Allow your feet to rest on the floor before standing. Rise slowly instead of rushing. Hold onto a stable piece of furniture if needed, and give your body time to adjust. However, occasional mild dizziness isn't the same as frequent or worsening episodes. If you regularly feel faint, experience repeated dizzy spells, or nearly lose consciousness, don't assume it's simply part of getting older. Those symptoms deserve medical attention. Your medication dosage may need adjustment. Your combination of prescriptions may require review. Your hydration habits could also be playing a role. One of the biggest mistakes people make is staying silent because the symptom seems too minor to mention. Yet what feels insignificant today could become tomorrow's serious injury. There's one final lesson that every person taking blood pressure medication should understand. It has nothing to do with side effects, swollen ankles, coughing, or dizziness. Instead, it involves something almost everyone with high blood pressure does at home: checking the numbers on their blood pressure monitor. Surprisingly, this simple habit creates enormous anxiety for many people, often leading them to make decisions that can do more harm than good. In the final part, we'll uncover why a single reading should never control your emotions, how to monitor your blood pressure correctly, and the most important habit that helps these medications protect your health for years to come. One of the biggest sources of stress for people living with high blood pressure isn't the medication itself. It's the numbers they see on their home blood pressure monitor. A single reading that appears higher than expected can ruin an entire day. Some people immediately assume their medication has stopped working. Others become so worried that they take an extra dose without medical advice. On the other hand, one unusually low reading may convince someone to skip tomorrow's pill because they believe their blood pressure is fixed. Both reactions are understandable, but neither is the right approach. Here's something every person managing high blood pressure should remember. Blood pressure is never a fixed number. It's constantly changing throughout the day. It responds to your sleep quality, your stress level, the amount of water you've had, whether you've recently exercised, if you've consumed caffeine, if you're experiencing pain, or even whether you're anxious about checking your blood pressure in the first place. Your body is designed to adjust continuously, and your blood pressure naturally reflects those adjustments. That's why a single reading rarely tells the full story. Imagine checking your blood pressure immediately after climbing a flight of stairs or after receiving stressful news. Naturally, the number may be higher than usual. Now imagine checking it after spending time in a cool room, relaxing quietly, and drinking plenty of water. The reading could be noticeably lower. Neither number alone defines your health. What matters most is the pattern over weeks and months. The most reliable readings are taken under consistent conditions. Use the same arm each time. Sit quietly for at least 5 minutes before measuring. Keep both feet flat on the floor. Avoid talking during the measurement. Try to check your blood pressure around the same time each day. When you collect readings consistently, your doctor can identify meaningful trends instead of reacting to isolated numbers. Unfortunately, many people do the opposite. They check their blood pressure randomly throughout the day, compare every reading, and become emotionally attached to each result. One slightly elevated number leads to panic. One unusually low number creates false confidence. Soon they're adjusting medications on their own, skipping doses, or taking extra pills, all based on temporary fluctuations that are completely normal. Instead of reacting emotionally, keep a simple record of your readings. Bring that log to every doctor's appointment. A well-kept record tells your healthcare provider far more than a single photograph of one alarming result. It allows treatment decisions to be based on reliable patterns rather than momentary changes. There's another important truth about medications like Amlodipine, Losartan, and Lisinopril that many people overlook. These medicines are designed to work steadily. They aren't rescue medications that you take only when your blood pressure is high. Their effectiveness depends on maintaining a consistent level in your body day after day. Skipping doses because you feel fine weakens that protection. Taking extra doses because one reading worries you doesn't improve their effectiveness either and may actually increase your risk of side effects. The safest approach is remarkably simple. Take your medication exactly as prescribed. Never stop it without speaking to your healthcare provider. Report new symptoms promptly instead of guessing their cause. Stay well hydrated unless you've been given different instructions. Ask your doctor about a sick day plan before you ever become ill. Discuss every prescription, over-the-counter medicine, supplement, electrolyte drink, and salt substitute you're using. These small conversations often prevent much bigger problems later. Remember Walter, whose swollen legs turned out to be a predictable effect of amlodipine rather than heart failure. Remember Evelyn, whose persistent cough disappeared after the real cause was finally recognized. Their stories remind us that medications aren't simply good or bad. They're powerful tools that work best when patients understand them. Knowledge transforms fear into confidence and confusion into better decisions. The goal isn't to become your own doctor. It's to become an informed partner in your healthcare. The more you understand your medications, the better prepared you'll be to recognize genuine warning signs, avoid preventable complications, and work together with your healthcare team to protect your health for years to come. If you found this video helpful, don't keep this information to yourself. Click the like button, subscribe to the channel, and turn on the notification bell so you never miss our upcoming health guides. Share this video with your family and friends, especially anyone taking blood pressure medication, because this knowledge could help them avoid unnecessary complications. And before you leave, tell me in the comments which medication you're taking and what health topic you'd like me to cover next. Thank you for watching, stay informed, stay healthy, and I'll see you in the next video.